It's now been almost 3 months since DePuy Orthopedics, a division of Johnson & Johnson, sent letters to doctors and patients letting them know that the ASR total hip replacement system was defective. By now you should have received a letter from your doctor or another healthcare professional telling you what to do in response to the recall. If you received a letter telling you that the hip implant you received was an ASR, it's important that you follow up with your doctor. As time has passed since the recall, we have learned that many of our clients who had the DePuy ASR system have highly elevated levels of cobalt and chrome in their blood. The DePuy components, the acetabular cup and the femoral head, are made of cobalt and chrome, and with excessive wear, levels of these heavy metals in the blood are increasing. As shown in this computer animation, because of the design of the ASR cup and ball, when the ball rotates within the cup, there is excessive generation of metal ions. Tiny microscopic particles of cobalt and chrome are being released into the patient's bloodstream. The release of these heavy metal ions and fragments into the patient's hip area are causing soft tissue damage, inflammatory reactions, infections, and pseudotumors. In a hip replacement that involves a non-defective cup and ball, the patient typically recovers and can expect anywhere from 10 to 15 years of normal, pain-free motion in the hip. With the DePuy ASR hip system, patients are finding that they are experiencing pain, popping, clicking, grinding, irritation, and inflammation of the soft tissues in as little as 2 years after surgery. The fact that your hip may feel stable is no guarantee that the ASR is not producing injuries in other areas of your body. If you or someone you know has had an ASR total hip replacement, it's important that you seek legal guidance from someone who is familiar with the biology, the medicine, the engineering, and the complications caused by these hips.